episode, we talk about the patients with depression and anxiety who suffer from years, even decades, without reaching out to the psychiatrist. What made them to do so? Today, we have Dr. Jian in our studio, and we will talk about this topic. Dr. Jian, really happy to have you in our studio today.
Yeah, I'm happy to be here as well.
Could you talk about what made them so hesitant to reaching out to the psychiatrist?
Well, that's a good question. The reason of seeing psychiatrists are more complicated than the reason of seeing other physicians. We have top 10 reasons to see physicians in general. For example, people see physicians because of itching, rashes, or because they have back pain, knee pain, or cough, or high blood pressure, depression. This is top 10 reasons to seeing the physicians in general. But the reason of seeing other physicians is much, much easier to see. For example, when people suffer injuries, they want to figure out whether they have broken their bones or not. So they usually go to the surgeon. And the surgeon do an MRI or CT scan can easily identify whether they have a fracture or not, which can 80%, even 90% sure. People go to see for primary care physician, family physicians, usually for high blood pressure, diabetes. That's also easy to see. But when patient, for the reason say psychiatrist is more complicated. Most people thought they say psychiatrist is because they have depression, they have anxiety. But that's much more complicated. It's because unlike fracture, unlike diabetes, high blood pressure, the anxiety depression is not measurable. It's very subjective. So even patient themselves oftentimes confuse what it is. They take their years to figure out, oh, they have depression or anxiety. So that's one of the reasons. Second reason is because the patient don't have objective symptoms. So oftentimes they thought this is their problem, their personal choice. Also, the people around them, they thought this malingering. They are currently weak or they're incompetent. So those social stigma also prevented them go to see psychiatrists. But many patients even really eventually see psychiatrists, it's because they have a problem in their life, commonly problem in the job. The reason of the people say surgeons, primary care physician, or similar like the apple. So I can use this analogy to help you understand how complicated it is. So listen, first time when you see the apple, what color do you describe?
Apple is red.
Red, right?
Yeah.
But when you watch that, yes, you're partially right. You're right about 5%. But if you peel off the first layer, then what did you see?
White.
White. Then you could write about 90%, 95%. When you first time see onion, what color do you describe?
Purple.
Purple, right? Yeah, you see the onion is purple, you partially right, 20%. It's because once you peel first layer, what color do you see?
White.
White. Yeah, if you see the color of the onion is white, you write about 40%. If you notice, after first layer and second layer and third layer, there's some place it's not purple. Even the onion, you can see it's not white or it's not purple. You still correct about 30%. So that's what you describe the color of the onion is complicated. So that is why people confused. So another big thing is more complicated is because the problem in their life. People go to see physicians. They keep telling you, I have problem with the anxiety, depression. Actually, they have problem in their life, but the anxiety, depression, or attention deficit attribute to the problems. So they consider once they see psychiatrists, then the problems in their life will be improved. But that's not the case. What do you see?
I see a girl.
Actually, that's not a girl. That's reflection. The girl, the girl is on the shore of the lake. So this is one hallucination. Another one's here. What do you see?
I see two trees.
Two trees,
with
right?
Two animals. Yeah.
But the dog keep barking the right tree. Now, from the left side, what did you see? You see
I see like three.
From your right side,
I see four.
Four, right?
Yeah.
This is your similar like when you say psychiatrist, for example, patient themselves emphasize they have depression, anxiety. But from providers, from psychiatrists, we realize they are not just anxiety, depression. More than that, they actually more problems in their life because we're studying a different perspective. So patients have difficult to understand why the physician keep focusing on the problems in their life. And they really feel depression, anxiety. So based on this slide, use this analogy can help patient and provider both to understand. It's because we study in the different parts. Then we can help understand patient. First layer, like onion, is depression, anxiety. But the second layer actually is because problems in their life. Second is this one. This slide, you can see the dog keep barking on the right tree, but the cat actually on the left side. This is especially important for us to understand the treatment of anxiety. Right now, the treatment for anxiety, most people consider Xanax, clonazepam, and Ativan are anxiety medications. Also, many people say when they have anxiety, initially they use alcohol to self-medicate themselves. They do feel their anxiety get better, but they also realize that things get worse and worse. Do you understand why the things will get worse and worse?
Yes. So I think the medication like the Xanax or the alcohol you just mentioned about, like they didn't solve the problem. They just like cover it temporarily because the problem didn't be solved. So it's gonna pile up.
Exactly. Same like this slide. You can see when we solve anxiety, we are talking about the right tree. So we keep trying to focus on the right tree, but the real problem is on the left side. What does that mean? For example, when people have anxiety, mostly it's because their capacity decreases. They cannot do what they're supposed to do. In other words, you can say it's because they cannot go to work. Then they cannot pay the rent, mortgage, car loan. They faced house foreclosure or faced eviction. So that's a problem on the left side. But people keep on trying to focus on the right side. Then the problem is here. Alcohol, Xanax, clonazepam, Ativan, they are sedative substances. Do you know what is the real problem with alcohol?
You cannot control yourself if you are drunk.
You know you should not drive after drinking. Is that right?
Yes.
Why? Why you should not drive?
Because you cannot control your body. You might like have a car accident. You cannot control the wheels.
Yes. Because alcohol can impair your functioning, decrease capacity, even you hold the wheel straight. That's how the police got people drunk driving. It's because they don't know you are drunk, but they can you see your car swerve like that. That's how you got caught, right? Yeah. So you can imagine you cannot hold your the wheel straight. You cannot do anything. So alcohol impair functioning, decrease capacity, and the Ativan, Xanax, clonazepam, they are with the alcohol in the same category. Are called sedative substances. It's depressing, it's decrease functioning. So we just talk about the left tree. The real problem is actually because of capacity decrease. You cannot do what you're supposed to do. And the alcohol, clonazepam, Xanax, the capacity further decrease. And that's why the anxiety is getting worse and worse. So we use this slide to more concretely help patients understand we need to address second tree, not left tree, not that you focus on right tree. So now we realize you can Ativan, Xanax, clonazepam, alcohol make anxiety worse. This one demonstrates another problems. Like you see, when you say there's a girl in the lake, actually the girl is on the shore. Especially when some patient they really had a severe problem in the career, in the job. Those things can make people overwhelmed. So probably the capacity is within the normal range, but because they keep thinking about, they have anxiety, they keep wanting to solve this problem in the lake. But that's similar like bark on the wrong tree, but more worse. It's because in this situation, we really need help to people underneath. We really need to address people underlying issue, like job issue, career issue, relationship. So this is like can help people understand more about why we need to understand anxiety attributed to the problems. So this goes both ways. In the future, we will help understand more about what kind of problems in the life can make anxiety worse.
Thanks for answering all our questions today. And please don't forget to subscribe to our channel so you won't miss our following videos. Thanks for Dr. Jason Jian comes to our studio again.
Yeah, I'm glad to be here. And if everybody wants to know more about depression, anxiety, attention deficit, or opioid dependence, please contact my office.